Hello dear students, welcome to Dr. JPL video lecture series. This video deals with ELISA technique belonging to Unit 4A Immunoblotting Techniques from the syllabus designed by Pharmacy Council of India for 3rd year B Pharmacy 6th semester, subject Pharmaceutical Biotechnology, and the subject code is BP605T. Myself Dr. J P Lavande, Associate Professor, Department of Pharmaceutics, Shivlingeshwar College of Pharmacy, Almala, Taluka Ausa, District Latur. Dear students, the ELISA details we have to cover as what is ELISA, what are the basics associated with ELISA and its principle, what are the benefits of ELISA, what are the general procedures that are used in case of ELISA, the different types of ELISA, direct ELISA, indirect ELISA, sandwich ELISA, and competitive ELISA, along with their advantages and disadvantages wherever applicable. Last but not the least, we have to see summary and the detailed interpretation associated with ELISA technique. This particular video deals with basics of ELISA, what is ELISA, benefits of ELISA, and the general procedure. In the subsequent video, we will see the types of ELISA, summary, and data interpretation associated with ELISA. So what is ELISA? ELISA is enzyme-linked immunosorbent assay. Is a plate-based assay technique designed for detecting and quantifying peptides, proteins, antibodies, and hormones. In an ELISA, an antigen must be immobilized to a solid surface and then complexed with an antibody that is linked to an enzyme. Detection is accomplished by assaying the conjugated enzyme activity via incubation with a substrate to produce a measurable product. The most crucial element of the detection strategy is a highly specific antibody-antigen interaction. ELISAs are typically performed in 96 well of polystyrene plates, which is passively bind antibodies and proteins. It is this binding and immobilization of reagents that makes ELISA so easy to design and perform. Having the reactants of the ELISA immobilized to the microplate surface makes it easy to separate bound from non-bound material during an assay. This ability to wash away non-specifically bound materials makes the ELISA a powerful tool for measuring specific analytes within a crude preparation. What is the principle involved in ELISA? Enzyme-linked immunosorbent assay operates on a principle very similar to other immunoassay technologies. ELISAs rely on specific antibodies to bind the target antigen and a detection system to indicate the presence and quantify the antigen binding. In order to maximize the sensitivity and precision of the assay, the plate must be carefully coated with high affinity antibodies, a process that Boster Bio has mastered. The benefits of using ELISA kits are its sensitivity. Single digit picogram detection can be possible with the help of use of ELISA technique. Second benefit is the specificity. Rigorously validated captured antibodies have low cross reactivity. The third benefit is stability, guaranteed to remain sensitive up to a year. The fourth benefit is service. Booster offers fast, insightful technical support. The general ELISA procedure. You can see it will follow through the 4 different steps, that is coating, blocking, detection, and read results. The very first step, that is the coating. Unless you are using a kit with a plate that is pre-coated with antibody, an ELISA begins with a coating step in which the first layer consisting of a target antigen or antibody is absorbed onto a 96 well plate of polystyrene. This is followed by blocking step in which all unbound sites are coated with a blocking agent. Following a series of washes, the plate is incubated with enzyme conjugated antibody. Another series of washes removes all unbound antibodies. A substrate is then added producing colorimetric signal. Finally, the plate is read. Because the assay uses surface binding for separation, several washes are repeated in each ELISA step to remove unbound material. During this process, it is essential that excess liquid is removed in order to prevent the dilution of solutions added in the next assay step. To ensure uniformity, specialized plate washers are often used. ELISAs can be quite complex and include multiple intervening steps, especially when measuring protein concentration in heterogeneous samples such as blood. The most complex and varying step in the overall process is detection, where multiple layers of antibodies can be used to amplify signal.